Okay, this is my trauma assessment. PPE, is my scene safe? I have one patient. I would consider C-spine. I would need to call ALS. I need to know the mechanism of injury, and that is it. Then I would go on to my general impression of the patient and how they look to me and what I see, and then I would check the patient to make sure if they are alert or painful stimuli, anything like that. And then I would, if the patient is conscious, ask their chief complaint about it. Then I would go into ABCs, airway first, make sure their airway is open and nothing's in or causing them not to be able to breathe. I would insert an adjunct if need be. Breathing, I would listen to their chest, watch their chest rise and fall, ask what respirations are, check what respirations are, and initiate oxygen if need be, depending on what I find out. Then I would go on to circulation. I would check their pulse and feel their skin, see if it's dry, warm, pink, see what that is. Then I would see if I can find any major bleeding anywhere and treat that depending on where it is. And then I would also initiate shock therapy, which I would put oxygen on them at 15 liters per minute, non-rebreather mask, and I would cover them with a blanket and put them in a position of comfort. And I would initiate transport as soon as possible. After that, I would get a set of baseline vitals. I have my blood pressure cuff, and I would do blood pressure, pulse, respirations, SpO2, all of that. And then if the patient was alert and could talk to me and answer questions, I would do a sample history. After that, I would run through a secondary assessment. I would go from head to toe, so I would start at the head. I would look for any major bleeding out of the ears, check pupils, anything like that, anything of the mouth or nose that's causing them problems. And then I would go to the neck, check for jugular distension if the trachea is in line, and then I would also do the back of the neck to make sure the spine's okay back there. Then I would go to the chest. I would listen for chest sounds with my stethoscope, continue to watch rise and fall of chests, press along their chest, make sure there's no tenderness or any discoloration. Then I would go to their abdomen. I would palpate around their abdomen, make sure there's no major bleeding or anything like that. And then I would go to their pelvis, palpate their pelvis, make sure it's stable. And then I would do the genital area if need be. Then I would go down to their lower extremity, do both legs. Then I would check their motor sensory with their feet. And then I would go up and do the upper extremity and check their motor sensory up there if they are able to, if they are awake. After that, I would log roll the patient over and do the back of them, check their spine, any major bleeding there. After that, if there are any secondary wounds, I would take care of them then, and I would reassess the patient every 5 minutes, making them comfortable or reapplying bandages or anything in that matter. And that